Hi, my name is Dr. David Naylor. I've been in private practice in Burlington, North Carolina since 1978. I consult with over 1,000 doctors around the country, and I'm the founder of Naylor Clinic of Chiropractic and Acupuncture, and the websites thenaylorclinic.com and askdrnaylor.com. Are you tired of running from doctor to doctor only to play Russian roulette with different medications? Here, try this drug that didn't work, try this one. It seems like they're all coming out with a new medication every month only to see it fail. Are you tired of taking drugs that don't fix the problem? Do you continue to struggle with constant pain day in and day out? I'm here to tell you that there is new hope. To see video testimonials of some of the patients that we and other doctors in this program have helped get relief from chronic conditions, visit the website at lifechangingcare.com. What makes us different from any other doctor you've seen? Well, we treat you metabolically and neurologically. You're watching this video because you or someone you love is suffering from a chronic disease that you've been told there's no cure for. I'm here to tell you that no stone is left unturned to determine the exact cause of your chronic diseases. I'll guarantee you that no one has told you what I'm about to tell you. I'm going to address what makes my program unique, how I successfully treat chronic conditions, and we do that by using specific metabolic and neurological protocols. The metabolic treatments are based on specific lab panels. By using specific blood tests, such as a thyroid panel, a complete metabolic panel, a lipid panel, a CBC, complete blood chemistry, and with an auto differential, we can assess your thyroid, adrenal glands, liver, kidneys, red white blood cells, and gut function with the above lab test. All internal functions can be affected with chronic health conditions. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you to heal faster. The CMP also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We do sensitivity testing to determine if you have a sensitivity to gluten, wheat, rye, oats, barley, milk, eggs, yeast, and soy. If you're sensitive to any of these food groups, it could be making your condition worse, as it will increase the inflammation in your brain and throughout your body. Here's some of the symptoms of these sensitivities: chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores, vomit often, autism and hyperactivity in children. The only way to find out if you're suffering from any of these sensitivities is to run the test. The 4 priorities in our treatment protocol with metabolic is anemia, blood sugar and adrenal stress index, the gastrointestinal tract and liver, and fatty acid metabolism. You can test the adrenal glands with a test called the adrenal stress index. This is a salivary test much like DNA testing. The adrenal glands sit right above the kidneys, and they're your stress organs, meaning that they react to stress. If the patient has been or are currently under stress, this test is a must. If you suffer from insomnia or blood sugar issues, this test is a must. It will measure your cortisol levels. When your body's cortisol levels are abnormal, you'll suffer from insomnia and/or problems with your blood sugar. Cortisol levels can be corrected by specific nutritional protocols. The immune panels are extremely important. As you know, an autoimmune disorder is where your immune system attacks a particular area of your body. Might be the nervous system, joints, connective tissue, thyroid. So we test the specific antibodies to determine if you suffer from an autoimmune condition. The immune panels are made up of the T and B lymphocyte subpopulation, the cytokine panels, which are IL-2, TNF-alpha, IL-4, and IL-10, natural killer cell activity. There are 2 parts to the immune system, the Th1 T cells and the Th2 B cells. IL-2 and TNF-alpha equals the Th1. The Th1 cells are the army that kill the bad guys. They attack and clean up afterward. The helper T cells, suppressor T cells, natural killer cells, regulatory T cells, and macrophages. IL-4 and IL-10 equals the Th2 B cells. The B cells make antibodies, and they tell the T cells what to kill. The testing comes back with a high B cell count. The patient is Th2 dominant. An imbalance between Th1 and Th2 is the root of autoimmune disease. You want to determine if there's an active antigen or dysregulation. Active antigens are parasites, bacteria, virus, mold, yeast, fungi, protozoan, foods, chemicals, and heavy metals. The best indicator for an active antigen as the cause of a patient's abnormal dominance is the helper-suppressor ratio on the T and B cell panel, also known as the CD4-CD8 ratio. The closer to 2.5 the ratio is, or if above that, the more likely it is that you're dealing with an antigen. If the ratio is below 1.2, then you're most likely dealing with a dysregulation problem. The immune panels give me an in-depth picture as to what is exactly happening with your immune system. If you're suffering from an autoimmune disorder, it obviously trumps everything, and it must be the first thing to be addressed. We can run a test for H. pylori bacteria to determine any problems related to the gut function. And we also test for intestinal permeability to determine if a patient suffers from leaky gut syndrome. Leaky gut describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infections that can lead to increased permeability of the gut wall to toxins, microbes, undigested food, waste, or larger than normal macromolecules. It's been proposed that these substances affect the body directly, while others postulate an immune reaction to these substances. We test decreased brain neurotransmitters. The neurotransmitters are vital for proper brain function. Decreases in neurotransmitters can cause increased pain. We can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Finally, we may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer from inflammatory processes. Just about every fibromyalgia patient that I have treated suffers from some form of chronic inflammatory process. We use glutathione in our treatment of all chronic conditions along with other nutritional protocols. Glutathione is the mother lode of antioxidants. Glutathione cannot be taken orally in pill form as the body will not absorb it. We've seen miraculous changes in our patient population as a result of our specific glutathione protocols.